All right, let's get into PUD. Okay, PUD, peptic ulcer disease. PUD, peptic ulcer disease. Okay, so what is it? Okay, what is peptic ulcer disease? Okay, it's in the stomach. Okay, it's in the stomach, and the diagnostic criteria or incidence or how they diagnose it and what it looks like, it is an open wound or an open sore in the stomach lining. Okay, in the stomach lining. Okay, this most commonly again occurs in the stomach lining, or it could even occur in the duodenum. Okay, that very top layer in the duodenum. You guys should know where the duodenum is. But right after you get from the stomach, that connection from the stomach, that first part of that small intestine. Okay, so that's where you can have the ulcers in those areas will be considered peptic ulcer disease. Okay, pain is the characteristic of the symptom. Okay, a dull, burning, like boring or gnawing pain. Okay, and the pain is located generally or primarily in the epigastric region. Okay, it may be caused by H. pylori. Okay, H. pylori or unresolved treatment. Okay, maybe someone didn't have any, they were asymptomatic for a while, and H. pylori has been left untreated for so long. Okay, and it now has ate at the lining of the stomach, creating this sore. Okay, that is a peptic ulcer. Okay, peptic ulcer or a stomach ulcer. Okay, also long-term NSAID use. Okay, that's another cause. Family history is a cause. Excessive alcohol is also a cause. Older than 60 years old can also be a cause. Common comorbidities to this is type O blood and Crohn's disease. Okay, those are other comorbidities. So treatment for this, food restriction. Okay, food restriction. If there are any aggregating foods, don't eat them. Why would you want to, right? No alcohol, no smoking, limit stress. Okay, stress is a big one. Okay, treatment, again, PPIs, your proton pump inhibitors. These are like your pantoprazole, omeprazole, esomeprazole. Okay, that's the class of medication that is going to help to treat these. Okay, that medication must be followed very closely. Okay, it inhibits the gastric secretion of acid, so it cannot be used for a long period of time, but it can be used to relieve manifestations of heartburn and regurgitation. Okay, and to help heal the ulcer. Okay, there's some adverse effects to those meds, to the PPIs, like headache, diarrhea, abdominal pain, and flatulence. Okay, but make sure that it is taken correctly, regularly, and not for a long-term basis. Okay, if they are taking them for a long period of time, they can develop disorders like hypocalcemia, hypomagnesemia. Okay, so again, domino effect. It can lead to other things. So not for a long period of time. Okay, not for a long period of time. Don't take it for a long time. All right, so more on PUD. Okay, more on PUD. I've already mentioned like the H. pylori, because that is key. Excessive NSAID use, that is also key. Okay, medical management, I gave you the medications. NG tube can also be used, okay, to kind of suck out the acid, to really give some kind of relief temporarily. Surgery, okay, it can be surgically repaired. All right, but it's key things: diet. Okay, diet. Avoid foods and beverages that's going to irritate the ulcer. Okay, adequate rest is another one. Adequate rest. Okay, so your nursing intervention, you will be the one to place the NG tube for irrigation or suctioning. Okay, and the things that you're going to want to look for is coffee ground emesis. Okay, you want to look at that. Why? Because that could indicate some bleeding, right? So you also need to determine, like, okay, is it going to be intermittent suctioning or continuous suctioning? All right, that's something you're going to want to get from the physician. Monitor the INOs. Okay, if you're suctioning and doing all of that, you need to make sure that they have a balance. Okay, good oral care. Okay, clear liquids, small frequent meals. Make sure they have their food log so they know which foods to avoid or which foods can aggravate the ulcer. And then increase fluid between meals, okay? Increase the fluid between meals. Eat slowly. You want to encourage them to eat slowly. Chew their food thoroughly, okay? They can be posed to like some weight loss as well, because again, if it hurts to eat, are you going to eat? No, that's again part of your domino effect. This is going to lead to this, that's going to lead to this, okay? They develop an ulcer, and then they don't want to eat, then now they have poor nutrition, okay? So one thing is going to lead to the next, all right? I think that pretty much covers ulcers. You know what? I didn't talk about like the psychosocial effects that ulcers can have. So anxiety treatment, depression treatment, that may be something that you may deal with your patients. Okay, they may get anxious. The pain alone may make them anxious. Okay, they may be depressed if they're struggling with their diet and struggling with weight loss and struggling with a healthy lifestyle. Okay, that may put them in a depression. And again, we treat holistically. We treat the whole patient. Okay, so these are some things that you should take into consideration as their nurse. Okay, that's PUD. That's it.